During pregnancy, dental care and oral hygiene are of particular importance. During this time, tooth damage can lead to health problems in the internal organs, and infections of the gums may even favor the triggering of miscarriages. The mother's body needs a significantly increased mineral supply during pregnancy. Over the course of the 9 months, the baby's organism alone has to incorporate 30 grams of calcium, which it can only get from the mother. This can lead to deficiency symptoms in the mother, which affects the teeth, among other things. In addition, the hormonal changes increase the acidity in the mouth, which makes the tooth enamel more susceptible. Due to the increased amount of blood in the body during pregnancy, gum bleeding can occur more often. The gums are more sensitive and more susceptible to infections. Chronic infections, in turn, can adversely affect the child through blood exchange. In order to minimize risks of this kind, deficiency symptoms and diseases should be prevented. Calcium deficiency can be prevented by eating dairy products, nuts and soya products, for example. You should make appointments with your dentist at the beginning of your pregnancy and in the 4th month of pregnancy. He will check the condition of your gums and treat them if necessary, as well as repair existing damage to teeth and give important tips for prevention during your pregnancy. If you have any questions on this topic, please contact us at the practice or make an appointment. We are gladly there for you.